Whooping cough cases are rising in parts of North Texas, and today Children's Medical Center confirmed that a child recently died there after getting the infection. The disease gets its name from the way the cough sounds, especially in children. It's a nasty bacterial infection, highly contagious, and children aren't the only ones susceptible. Fox 4's Emily Lopez reports many of these cases involve adults who have not been vaccinated.
That's with the Pertussis.
Phyllis Kahn is not taking any chances. She's at the Dallas County Health Department getting vaccinated for pertussis, or whooping cough. Kahn wants to avoid getting the bacterial infection and passing it on to her grandchildren.
I'd rather be safe than sorry, about far as spreading anything or getting sick.
In fact, Dr. Jeffrey Kahn at Children's Medical Center says just within the last month, he's seen a spike in the number of cases.
We had a young infant who presented with respiratory difficulties, who was diagnosed with pertussis, who ultimately went on to respiratory failure and died because of pertussis.
Kahn says between April and May, there were 12 documented cases at Children's Medical Center. 11 were children. 7 out of the 11 children were less than 2 months old.
It's highly contagious, particularly to household contacts. And remember, infants are the most prone population.
Infants have not yet developed the immune system to fight the infection. This public service announcement aired in English and Spanish to warn parents about the dangers of the illness.
Well, it is scary, of course.
Olga Carroll and her husband have gone to great lengths to make sure both their girls are current on their shots.
We are up to date on their vaccines. We actually have a visit scheduled for 15 months checkup this week.
While many people get a series of shots as children to protect them from whooping cough, adults are not as vigilant about getting themselves to a doctor to get the vaccine, and that vaccination weakens over time.
I would recommend, and the CDC recommends, that parents of young children get their booster dose of pertussis vaccine.
All right, Emily Lopez is now to talk more about this. First, let's talk about the child who died. I don't know if we know child, infant, him or her. What do we know about this
about
child?
1 month old, but they stopped short of telling us anything more about the child because of privacy issues. They were able to tell us that the child died within the last month. That's it. That's all we know so far.
Okay, so that child, part of this increasing number of cases in Dallas County. Did you call around and see what else is going on in the surrounding counties?
Tarrant County, interestingly enough, they've had a decrease in the number of cases, so they've seen a downward spiral.
Right.
Now, in terms of any other counties that have had an increase, Denton County, exact opposite. They've seen a huge surge in the number of cases. It parallels or it mirrors what's going on in Dallas County. And one of the questions I asked the doctor is, why? Why are we seeing this?
Right.
He says it's just part of the natural fluctuation of the illness that happens from year to year. You see cases drop off, then you see the cases pick back up again. So
interesting that it's so different. I guess it doesn't travel. It's located centrally in an area and very contagious. So that's how it happens. Emily Lopez.